Welcome to the lecture on Introduction to Occupational Disease. At the end of this lecture, you should know how to diagnose an occupational disease, and the spectrum of occupational diseases. Most of the adult working population spend more than one-third of their daily time in a workplace. They bring along with them pre-existing psychosocial, socioeconomic, genetic, dietary, environmental, and habitual background from wherever they came from, to the workplace environment. These working population will have a baseline health status that probably will maintain the same, if they continue to stay in their home environment all the time. However, due to frequent exposure to work environment, the health status changed, attributable to the effects of hazards in the workplace. The hazards can be from the work itself, workplace environment, or tools used, and interact with the individual's susceptibility, giving rise to diseases or illnesses. If there is inadequate health prevention and protection in the work environment, the affected workers might end up with poor health, diseases, or death. This is where the importance of recognizing and managing occupational diseases comes in. We can generally categorize diseases caused by the work environment into two categories. First, occupational diseases, and second, work-related diseases. What is an occupational disease? Occupational diseases are diseases that occur due to the causes and conditions attributable to a particular occupational environment, and not to stimuli encountered outside the workplace. In other words, an occupational disease is any disease contracted primarily as a result of an exposure to risk factors arising from work activity. The same disease, if it was contracted outside the work environment, is not considered an occupational disease. Hence, the fact that a disease occurs solely because of work is utmost important in considering whether a disease is an occupational disease or not. Work-related diseases, on the other hand, are diseases not solely caused by, but associated with work environment. Work-related diseases have multiple causes, where factors in the work environment may play a role, together with other risk factors, in the development of such diseases. Work may be associated in their causation, or may aggravate or worsen a pre-existing condition. Although in work-related disease, work is never a sole causative factor for the development of the disease, it is equally important as the occupational disease because it may impose serious health consequences and negative impact on productivity. How do we diagnose an occupational disease? In general, the diagnosis of any occupational disease can be based on four basic criteria. The criteria are: presence of relevant effect, evidence of exposure, appropriate temporal relationship, and exclusion of differential diagnoses. In order for a disease to be regarded as an occupational disease, the symptoms and signs should be consistent with what is known about the occupational disease. For example, Minamata disease is caused by mercury poisoning. Hence, if the symptoms and signs of a disease point toward a collective clinical condition which is similar to that caused by the exposure to organic mercury, then we can suspect the occupational disease, which is Minamata disease. The symptoms and signs must be evaluated by a medical doctor through proper clinical consultation. Besides relevant effects, the evidence of exposure to relevant hazards that caused the relevant effects must also be available. The relevant hazards must be proven present in the workplace and the exposure intensity must be sufficient. The information can be obtained via a proper workplace investigation or by review of relevant workplace assessment reports, such as Chemical Health Risk Assessment Report, Noise Risk Assessment Report, etc. After you have confidently established that a hazard is present in the workplace, and the symptoms and signs of a patient is relevant to the effects of the exposure to that hazard, you must also confirm that the time sequence of the exposure and the development of the symptoms is appropriate. In the context of the development of occupational disease, the exposure must precede the outcome, and the exposure must sufficient over a minimum period of time. Following exposure, there will be a latent period before the symptoms develop. Different diseases have different latent period. Based on the established knowledge about an occupational disease, one must make sure that the latent period is appropriate before the diagnosis of the occupational disease can be made. Lastly, we must consider the possibility of non-occupational causes for all cases before we make the diagnosis of occupational disease. Occupational disease is a diagnosis of exclusion. However, sometimes we do make conclusion based on the balance of probability for difficult or controversial cases. We weigh the likelihood the diagnosis of occupational disease against the purpose of making such diagnosis. If the purpose is mainly for the workplace intervention to protect the workers, overdiagnosing is better than underdiagnosing. On the other hand, the purpose of diagnosis is mainly for financial compensation, stricter diagnostic criteria should be applied, and overdiagnosing should be avoided. Why is it important to diagnose an occupational disease? Well, work environment is one of the important causes of human diseases. Diagnosing an occupational disease is important because occupational disease is preventable. The presence of occupational disease indicates that the workplace condition is poor, and that can be managed to improve the health condition of the workers. Besides, occupational disease is financially compensable in most of the countries. Hence, diagnosing an occupational disease helps a worker to get financial compensation for his condition. Occupational disease, following diagnosis, can be managed to restore productivity, company image, workers' commitment to the company. These are the factors contributing to the development of occupational disease. We can categorize these factors into physical hazard, chemical hazard, biological hazard, ergonomic hazard, and psychosocial hazard. We have covered these hazards in the lecture on Introduction to Occupational Health. Occupational diseases can be classified based on body system or hazards. For example, we can classify occupational diseases into occupational lung disease, occupational dermatosis, occupational musculoskeletal diseases, and so on. We can also classify the diseases based on hazards such as noise-induced hearing loss, heat-related illnesses, radiation-related illness, and so on. Here, I will give you examples of some common examples of occupational diseases. Noise-induced hearing loss is the commonest notifiable occupational disease worldwide. It is caused by exposure to hazardous noise level. The hazardous noise is considered as exposure to daily 8 hours time-weighted average of 85 decibel and above. Noise-induced hearing loss once occurred is irreversible, and there is no treatment for it. Noise-induced hearing loss is always sensory neural loss. It is nearly always bilateral and symmetrical, although sometimes, one side might have more severe loss than the other side. The hearing loss is usually slowly progressing, but the progression stops once the noise exposure ceased. Maximum hearing losses usually occur after 10 to 15 years of chronic exposure. Noise-induced hearing loss can be detected by audiometry test. Work-related asthma is a common occupational lung disease. It can be classified into occupational asthma and work-aggravated asthma. Occupational asthma is asthma caused purely by exposure to workplace's asthmagens. The onset of asthma is usually during adulthood and developed only after exposure at work for a period of time. Occupational asthma is a compensable disease in most countries. Work-aggravated asthma is the pre-existing asthma aggravated by exposure to workplace's environmental factors. The onset can be either during childhood or adulthood. The patient typically has a history of asthma before entering a particular workplace. Following repeated exposure, the asthma become worse. Pneumoconiosis is still common in some countries. It is a group of occupational lung diseases caused by inhalation of inorganic dusts, usually mineral dusts, resulting in the damage of lung parenchyma. There are many types of pneumoconiosis, usually named according to the type's mineral dusts. The common pneumoconiosis includes silicosis, coal workers' pneumoconiosis and asbestosis. Silicosis is caused by inhalation of silica dusts, usually in quarry or in the industries involved in silica processing or manufacturing activities. Asbestosis is caused by long-term inhalation of asbestos fibers. It is common in insulation or construction materials manufacturing industries. Coal workers' pneumoconiosis is caused by inhalation of coal dust, and commonly occur among the coal mine workers. In contrast to pneumoconiosis, organic pneumonitis is an immunologically mediated inflammatory disease of the lung parenchyma that is induced by inhalation of organic dusts that contain a variety of etiological agents. Organic pneumonitis is also known as extrinsic allergic alveolitis or hypersensitivity pneumonitis. Common organic dust includes dairy and grain products, animal dander and protein, wood bark, water reservoir vaporizers, cotton, mold, and so on. Organic pneumonitis usually named according to the nature of the occupation that caused the disease. For example, the name farmer's lung is given to the organic pneumonitis caused by exposure to moldy hay, which is common among the farmers. Bagassoses came from the term bagasse, the dry pulpy fibrous residue that remains after sugarcane are crushed to extract their juice, is the pneumonitis caused by exposure to moldy sugarcane fiber. You can see there are many types of organic pneumonitis from this table. Occupational dermatoses are skin disorders caused by exposure to workplace hazards. The examples of occupational dermatoses are contact dermatitis, contact urticaria, pigmentary disorders, skin cancers, skin infections and acne. Occupational contact dermatitis is the commonest form of occupational dermatosis. It can be divided into two types, the irritant contact dermatitis and allergic contact dermatitis. Irritant contact dermatitis is caused by exposure to irritants in the workplace. It usually affects most of the workers in contact with the irritants. The irritants give rise to localized acute toxic effect to the skin, usually small amount at a time, cumulatively insulting the skin over a period of time, giving rise to inflammation of the skin. Allergic contact dermatitis, on the other hand, is acquired sensitivity to allergens in the workplace, rather than irritants. It usually occurs only in the worker who has prior exposure to the same allergens, and developed type 4 hypersensitivity reaction following subsequent exposures. Here are some examples of irritants and sensitizers commonly found in the workplace. Occupational musculoskeletal diseases are a group of diseases caused by muscles, tendons, ligaments, or bones injuries following exposure to ergonomic hazards in the workplace. Examples of musculoskeletal disorders commonly associated with work exposure are carpal tunnel syndrome, trigger finger, tennis elbow, golfer's elbow, plantar fasciitis, and bursitis. The development of musculoskeletal disorders in occupation is a result of imbalance between an individual's physical capacity and the physical work demands. The physical demand at work stresses humans' musculoskeletal system, resulting in musculoskeletal strain, and together with psychosocial stress, often giving rise to fatigue and pains. The musculoskeletal injuries may recover if there is ergonomic improvement to the physical work demand or rest. Without any intervention, the acute musculoskeletal injury will progress to chronic musculoskeletal disorder. One of the commonest complaints the occupational health doctors encounter in occupational health clinic setting is low back pain. Low back pain is found to be one of the commonest health reasons given for work loss worldwide. 60 to 80% of adults experience low back pain at some time, and it is more common among those more than 45 years old. Low back pain is not an occupational disease, and certain not a disease at all. It is a symptom. Without a proper diagnosis that give rise to low back pain, one cannot attribute the symptom of low back pain to any occupational cause. In the workplace setting, any worker presented with low back pain should be investigated for underlying cause. Occupational cancer is cancer caused by exposure to workplace hazards. The hazards can be physical, biological, or chemical substances. The diagnosis of occupational cancer is frequently challenging due to difficulty in establishing the dose-response relationship between the exposure and outcome. These are some commonly known carcinogens in the workplace. Most of the carcinogens are chemical substances. Physical hazards such as X-ray, sunlight, and other ionizing radiations are known to cause cancer as well. In occupational medicine practice, we often refer to International Agency for Research on Cancer classification to decide whether a substance is a carcinogen or not. This information is often stated in the material safety data sheet. If a substance is classified as Class 1, consider it as carcinogenic to human, and the diagnosis is pointing towards occupational cancer. Injuries in the workplace are not diseases as such, but they are commonly seen in the company's in-house clinic or panel clinics for treatment. Needle stick injury is usually seen by occupational health doctor, not because of the physical injury the needle inflicted, but the underlying infectious disease due to biohazard exposure. The injury cases are often referred to occupational health doctor for fitness to return to work assessment, rehabilitation, and compensation evaluation. Commuting accidents are considered occupational injuries, and are compensable financially in most of the countries. Mental health problems commonly associated with workplace environment are depression, anxiety, stress, post-traumatic stress disorders, suicidal intent, and overwork-related unknown death. Nevertheless, making a diagnosis of occupational mental health disease is extremely challenging. It is extremely difficult to establish a direct causal relationship between workplace psychosocial hazards with the mental health problems. Hence, mental health problems in the workplace are usually addressed collectively as an organization, using preventive and corrective measures, such as screening, counseling services, motivation, incentives, and so on. Pulmonary tuberculosis, hepatitis B, and HIV infections are common occupational infections affecting healthcare workers. With the rapid globalization, business travelers and foreign workers are at risk of contracting highly communicable diseases such as SARS, MERS-CoV, COVID-19, etc. Although some occupations are at higher risk of contracting certain infections, sometimes it is difficult to differentiate occupational-specific infection from general environmental infection because the source of infection is presence in the community and environment. Exposure to toxic chemicals in the workplace is associated with diseases specific to the chemicals exposed. For example, lead causes anemia and peripheral nervous system damage, mercury causes neuropsychiatric disorders and Minamata disease, nickel causes skin and lungs allergy, and mercury causes Parkinsonism. We can establish the occupational relatedness between the chemical exposure and the related disease by confirming the chemical exposure, temporal relationship, dose-response relationship, and relevant disease characteristics. The types of occupational diseases described in the previous slides are not exhaustive. There are many more different types of occupational diseases. We usually refer to the International Labour Organization's list of occupational diseases for the purpose of official recognition of certain occupational disease in doubt. This document is available free from the International Labour Organization's website for further reading. Thank you for your attention.